guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering esophageal issues. Now, you know what I'm about to say next. If you haven't done so already, be sure to like and subscribe below. Press that red button so you'll be notified every time a new video is released. So without any further ado, guys, let's get started. Which statement regarding the factors responsible for the development of esophageal... I can't speak, guys. Let me start over. Which statement regarding the factors responsible for the development of esophageal reflux disease is true? A, esophageal reflux occurs with decreased lower esophageal sphincter tone. B, esophageal reflux occurs with increased lower esophageal sphincter tone. C, esophageal reflux occurs when the lower esophageal sphincter tenses. Or D, esophageal reflux occurs with decreased intra-abdominal pressure. And I'll give you a moment to think of your answer. So the correct answer, the one that's true, is A, esophageal reflux occurs with decreased lower esophageal sphincter tone. So that lower esophageal sphincter, also known as the cardiac sphincter, what happens is the tone, excuse me, should be increased, right? Very tight. You can't see anything. What does that mean? Nothing is getting through that bad boy. But when the tone is decreased or the sphincter is relaxed, it does what? Open up, open up, open up. So all of the food, including the hydrochloric acid that was in the stomach, because remember, hydrochloric acid, that's what breaks down the food, right? So all of that acid that's supposed to be breaking down the food in the stomach, because that sphincter is open and not closed, because the tone is relaxed and not tight, because the tone is decreased, not increased, all of that hydrochloric acid that's in the stomach, it creeps up into the esophagus. And what does it do to the esophagus? What does hydrochloric acid do? It burns. It breaks down the tissue of the esophagus. That's what reflux is. Reflux is when the gastric contents, specifically the hydrochloric acid that's supposed to remain in the stomach, when it creeps up into the esophagus, that's what's known as reflux. And so A is correct because this happens when the tone is decreased. We want the tone to be increased because when it's increased, that sphincter is what? Tight. Nothing's getting through that bad boy. The hydrochloric acid will remain in the stomach where it's supposed to be. Let's look at our wrong choices. Choice B, esophageal reflux occurs with increased lower esophageal sphincter tone. No, that happens when the tone is what? Decreased. That's when the patient has reflux. Choice C, esophageal reflux occurs when the lower esophageal sphincter tenses. That's wrong. When that sphincter is tense, that means it's closed, it's tight. Reflux happens when it's what? Relaxed. Choice D, esophageal reflux occurs with decreased intra-abdominal pressure. Reflux happens with increased intra-abdominal pressure. So what does that mean? So for example, the patient had a big lunch, right? And that lower esophageal sphincter, also known as the cardiac sphincter, you know, it's already a little bit relaxed as it is. And then the patient where it puts a tight belt around their stomach. What do you think that tight belt does? It increases the stomach, it increases the pressure on the stomach, and it forces the food that was in the stomach to creep up into the esophagus since the sphincter was already kind of relaxed anyway. So we don't want anything to increase the abdominal pressure because with increased abdominal pressure, the patient's at risk for what? Reflux. So one of the things we're going to tell the patient to stay away from is tight clothing and belts. Why? Because that increases the abdominal pressure and that can cause reflux. All right, next question, guys. Which of the following clients is most at risk for gastroesophageal influx? A, a client who drinks decaffeinated beverages. B, a client who has an NG tube placed. C, a client taking oral hypoglycemic agents. D, a client who eats small, frequent meals. And I'll give you a moment to think of your answer. And the correct answer, guys, is A, the client who has an NG tube placed. Why? Think about it. Where does the NG tube go? It goes through the mouth, down through the esophagus, right, into the stomach. So it has to go through that sphincter to get to the stomach. So guess what that tube does? Loosens the sphincter. Okay, so that can cause hydrochloric acid that's supposed to remain in the stomach to creep up to the esophagus. That would put the patient at risk. Let's look at our other choices. A, the client who drinks decaffeinated beverages. That doesn't place the patient at risk. That's actually a good thing. Why decaf? Because caffeine promotes reflux. Anything that has caffeine in it. So guess what I'm talking about? I'm talking about coffee. I'm talking about tea. What else can cause reflux? Believe it or not, peppermint, chocolate, okay? Acidic foods such as tomatoes, oranges. So we teach these patients who have reflux already to avoid these type of things. So the decaffeinated beverages, that's good. No caffeine. Wonderful. Choice C, taking oral hypoglycemic agents. That's not going to put the patient at risk for influx. And then we have choice D, eating small frequent meals. That's wonderful. We want small frequent meals. What we don't want is the patient to eat a big large meal, because what does that do? Now your stomach's all full, and guess what that big large meal does? Increases the intra-abdominal pressure, and it promotes reflux. So we tell the patient, small frequent meals. Stay away from tight clothing and belts. Stay away from caffeine. Stay away from acidic foods. Okay? So choice B is the correct answer. Next question. The client with esophageal reflux is experiencing regurgitation while sleeping that awakens the client. What complication of this problem is the client most at risk for? A, erosion, B, aspiration, B, bleeding, C, aspiration, or D, adenophagia, And I'll give you a moment to think of your answer. And the correct answer is A, aspiration. This is what we're most concerned about. That's why we teach the patient after they've eaten a meal, let's say it's dinner, they need to wait at least 2 to 3 hours before they go to sleep. Because what we don't want to happen is when they lie down to go to sleep, the contents of the stomach go up into the esophagus. That patient can start choking. Before you know it, some of the food or that gastric contents go where? Into the patient's lungs. Airway, that's what we're most concerned about. So we don't want them to aspirate. So that is our biggest concern for that patient with influx. And that's why it's so important that we teach the patient after your last meal before you go to bed, 1, you need to wait a couple hours before you go to sleep, and 2, you need to sleep with your head elevated. We don't want their head flat, because that gravity will help the food and the hydrochloric acid that was in their stomach to creep back into the esophagus, which we don't want to happen. Which assessment should you perform for a client experiencing regurgitation? A, auscultation for crackles. B, inspection of the oral cavity. C, palpation of cervical lymph nodes. Or D, culture of the throat for bacterial infection. And the correct answer is A, auscultation for crackles. We just talked about this. What is our biggest concern, complication we're worried about when it comes to reflux, regurgitation, aspiration? We don't want that patient to aspirate. Some of that food or the gastric contents get into the patient's lungs. Guess what that can cause? Pneumonia and all types of other issues, right? Is there supposed to be hydrochloric acid, fluid, food in the lungs? Absolutely not. So you want to listen to the lungs for what? Crackles, that's a sign and symptom that there's fluid in the lungs, which there should not be. So that's why A is the correct answer. A client diagnosed with Barretts esophagus complains of dysphagia. What complication of this condition should you be alert for in this client? A, achalasia. 2, esophageal stricture. B, paraesophageal hernia. Or D, oropharyngeal dysphagia. And I'll give you a moment to think of your answer. And the correct answer, guys, is B, esophageal stricture. So let's talk about this. When the patient gets Barrett's, what happens is, after that patient's been having reflux for a long time, so a long time, you have hydrochloric acid creeping up into the esophagus, creeping up into the esophagus, creeping up into the esophagus. Guess what? That hydrochloric acid starts to change the lining of that patient's throat, okay? And that Barrett's actually is a precursor to that person getting throat cancer. All right. So that patient with esophageal, Barrett's esophageal, we're concerned about the lining of their throat actually changing, and from it being burned so many times from the hydrochloric acid, that patient can develop fibrosis. And this is what we're worried about. It can lead to scarring. Okay, and what could that lead to? All other types of complications, such as aspiration. So that is our biggest concern when it comes to Barrett's, with the choices that we've been given here. Absolutely esophageal stricture. You're preparing a teaching plan for a client with gastroesophageal reflux. Which of the following instructions should you include in a dietary guide for this client? A, eat 4 to 6 small meals each day. B, eat a small evening snack 1 to 2 hours before bed. C, drink carbonated beverages between meals only. D, you may include orange or tomato juice with your breakfast. Okay, guys, so the correct answer is A, eat 4 to 6 small meals each day. Like I told you before, it's very important that they have frequent but small meals, because the big meals increases the patient's abdominal girth, which increases the intra-abdominal pressure, which does what? Loosen the sphincter, relax the sphincter, decrease the pressure on the sphincter, which we don't want, because when that happens, the hydrochloric acid that's supposed to stay in the patient's stomach creeps up into their esophagus. So number 1 is absolutely correct. We want small, frequent meals. Let's talk about why frequent, because I keep telling you small, frequent meals, and I explained to you why we want small meals, but I have explained to you why we want frequent meals. I want you to think about this. I'm going to use myself as an example. I love pizza. I love pizza. I love good pizza. Okay? Did you know that as human beings, just the thought, just the smell of a food, guess what? It promotes secretion of hydrochloric acid in your stomach, because your brain tells your stomach, oh, you're about to eat, so go ahead and start making this hydrochloric acid, so when the food gets in your stomach, you can break it down, right? So your stomach is always secreting hydrochloric acid, even if it's in small amounts. Well, guess what? If you don't have any food in your stomach, and your stomach is still secreting hydrochloric acid, what's it going to break down if there's no food there? Your own stomach lining. Yeah, that's what happens. So that's why we want small and frequent meals. Small meals to decrease abdominal girth, so there's not increased abdominal pressure, right? So it doesn't open up the sphincter. But frequent meals, so that there's always a little something in the patient's stomach, so the hydrochloric acid will break down that little something and not your own stomach lining. Okay? Let's look at our other choices. We have B, eat a small evening snack 1 to 2 hours before bed. Well, you know that's wrong, because I've already told you that we teach this patient their last meal needs to be a good 2-3 hours, even 4 hours before they go to sleep. We don't want them lying down to go to sleep and their stomach is still making all of this extra hydrochloric acid because there's a lot of food in there. So that's wrong. Choice C, drink carbonated beverages between meals only. Let me tell you look at how they try to trick you. Because another thing that we teach these patients is to drink between meals, not with meals. So if they're having dinner, eat the dinner first and then drink. Don't take a bite, drink, bite, drink, bite, drink. So you see how they put a half truth in that question just to kind of throw you off? So yes, we want them to drink between meals and not with meals, but not carbonated beverages. Carbonated beverages such as sodas, excuse me, tea, coffee, orange juice, tomato juice, citric, peppermint, chocolate, they need to stay away from. So that is wrong. Choice D, you may include orange or tomato juice with your breakfast. Now you know that's wrong. The patient needs to stay away from that. All right, next question. A client with severe GERD is still having symptoms of reflux despite taking omeprazole 20 milligrams daily. What is your best action? A, document the finding as the only action. B, notify the doctor. C, instruct the client to stop the medication immediately. Or D, instruct the client to take an antacid in addition to the omeprazole. And the answer is B, you're going to notify the doctor immediately. Why are you notifying the doctor immediately? Because this med is not working. So the patient's probably going to need an increased dosage, right? Because right now this patient's on a low dose, they're only on 20. Okay, doctor might need to increase that dosage. But guess what? The doctor has to increase the dosage. That is out of your scope of practice. You cannot increase a patient's dosage. You can't tell them to take another medication. You be playing doctor. So you're going to let the doctor know that, you know, patients taking their meds, they say that they're taking their meds as ordered, but they're still having these symptoms, and the doctor is going to increase the dosage. Let's look at our wrong choices. A. Where am I? Oh, okay, there we go. A. Document the finding as the only action. So you mean to tell me something is wrong? The patient's telling you something is wrong, and you're only going to document the findings? Really? You don't ever do that, guys. Whenever you guys get a question about something being wrong, you have to do something about it. You never just document. No, you have to do something about it. So we're going to get rid of that. That's not the right answer. Choice C, instruct the client to stop the medication immediately. You're not going to do that. They need that medication. They need it. You're not going to tell them to stop it immediately. Choice D, instruct them to take an antacid in addition to the omeprazole. Oh, you playing doctor now. Really? You trying to lose your license? We're not going to do that. We're going to notify the doctor, and we expect that doctor to increase the dosage or maybe add another medication or maybe switch out that patient's medications. What intervention should you suggest to a client to prevent nighttime reflux? A, sleep in the right lateral decubitus position. B, have a light evening snack before bedtime. C, have alcoholic beverages early in the evening. Or D, elevate the head of the bed 8 to 12 inches for sleep. And the only correct answer here is elevate the head 8 to 12 inches before sleep. Why do we want the head so high? Because gravity will help keep that food and hydrochloric acid in the stomach where it belongs, right? The lower that the patient lies down, the more chance that the patient has of the hydrochloric acid creeping up into the esophagus, which we don't want. We don't want that reflux. So with their head elevated, gravity will help keep the hydrochloric acid where it belongs, in the patient's stomach. Now, choice A, B, and C are all no-nos. A, sleep in the right lateral decubitus position. No, we want that patient sleeping with the head elevated. Choice B, have a light evening snack before bedtime. You know that's wrong, because we don't want that patient eating a good 2 to 3, even 4 hours before they go to sleep, depending on your book. Choice C, alcohol. No, guess what? Alcohol is something else that causes reflux. Stay away from alcohol. Alcohol is another no-no on our list. So we got lots of no-nos here, right? We got the carbonated beverages. We got the alcohol. We got the tea. We got the chocolate. We got the peppermint. We got the orange juice. We got the tomato juice. Anything that is acidic, right? The patient needs to stay away from. Stay away from anything that increases intra-abdominal pressure, such as tight clothing, such as belts, such as eating heavy meals, right? A client who has undergone fundoplication for GERD is ready for discharge home. What instructions should be included in the discharge teaching for this client? A, you will no longer need any medication. B, avoid spicy foods because they can irritate the suture line. C, you should take anti-reflux medications only when you eat a large meal. Or D, you will need to continue to watch your diet and take your medication. And the correct answer is D. You will need to watch your diet and take your medication. So yes, they had the surgery, but guess what? They still need to watch their diet and take their medication. What kind of medication do you expect them to be on? Expect them to be on anti-reflux medication such as omeprazole. Maybe you expect they might be on another type of PPI. They might be on a medication, an H2 blocker, you know, the list goes on. But whatever the doctor prescribes for that patient, they need to continue taking that medication and continue watching their diet. Small, frequent meals, making sure that they avoid all the foods on the list that we already talked about. And here's another one that I'm going to add to: spicy foods. They need to stay away from spicy foods, because what happens if that patient does have a little bit of reflux, it's going to irritate the esophagus. Okay, and spicy foods is irritating to the patient that already has a reflux, that already the lining of their stomach and esophagus is not 100% intact. So that's how they try to trick you, because if you look at choice B, it says avoid spicy foods, which is correct. Absolutely, those patients with GERD, with reflux, need to avoid spicy foods. But look at the rest of what it says, because they can irritate the suture line. No, they irritate the gastric line, the GI line of the stomach and the esophagus. That's why the patient needs to stay away from spicy foods. And you guys need to be careful with that, because let me tell you, these test writers, they'll give you half of an answer that's correct and everything else is wrong to try to trick you. But let me tell you this right now. If 100% of that answer choice is not correct, the whole thing is wrong. Go with the second best answer. 100% of your answer choice has to be correct, okay? If 100% is not correct, only half, only 75, it's wrong. Move on to your second best answer choice. Let's look at our other choices. You'll no longer need any medication. Okay, I talked to you about that. I talked to you about B. Okay, C, you should take anti-reflux medications only when you eat a large meal. You need to take your anti-reflux medications as ordered by your physician. You're going to be taking it every day, maybe twice a day, maybe once a day, depending on what the doctor puts the patient on. But they need to take it as ordered, not only when they eat a large meal. And remember, they're not supposed to be eating large meals anyway. Their meals are supposed to be what? Small but frequent. Which of the following statements made by the client indicates an understanding of the management of hiatal hernia? A, I will lie flat for 30 minutes after each meal. B, I will remain upright for several hours after each meal. C, I will have my blood count done in 2 weeks to check for anemia. Or D, I will sleep at night lying on my left side to prevent nighttime reflux. By now, guys, I know you guys have this packed. You're going to choose the correct answer. You're going to make me so proud, because you all know that the correct answer is B. I will remain upright for several hours after eating each meal. Why? Because that patient understands that they don't want to get reflux. Let's look at our wrong choices. I'll lie flat for 30 minutes after a meal? Absolutely not. You don't want the gastric contents to creep back into esophagus, so we know that's wrong. Choice C, I'll have my blood count done every 2 weeks to check for anemia. This patient has a hernia, not Barrett's. Remember I told you Barrett's, that's when it changes the lining of the esophagus. Okay, and with the changing of the lining of the esophagus, why is the lining of the esophagus changing? Because of the hydrochloric acid. It's actually burning that lining and changing it, okay? And that patient can be at risk for bleeding. The patient who has Barrett's, they are at risk for bleeding. So that type of patient would be doing their blood count. We'd be looking at their hemoglobin, hematocrit, make sure they're not bleeding out. Make sure we don't see them swallowing a lot. If they're swallowing a lot, what do you think they're swallowing? Their blood, right? But we're not talking about Barrett's. We're talking about a hernia. So that's wrong. And then we have choice D, I'll sleep at night lying on my left side to prevent nighttime reflux. They need to sleep with their head what? Elevated. So the correct answer is B. I will remain upright for several hours after each meal. What statement made by the client indicates a need for further teaching regarding dietary instructions for a client who has undergone fundoplication surgery? A, I will eat 3 meals per day. B, I will drink only decaffeinated coffee. C, I will begin oral intake by taking only clear fluids. Or D, I will eliminate carbonated beverages from my diet. And the correct answer is A, I will eat 3 meals per day. Why is this the correct answer? Because the question's asking us which one needs further teaching. Whenever you see a question asking you which one needs further teaching, which do you need to correct, which do you need to clarify, which one needs a follow-up, all of that is asking you which one's the wrong answer choice. And the wrong answer choice is A, I will eat 3 meals per day. No, the patient needs small but frequent meals. So they need to be eating a good 5 to 6 times per day. The meals are going to be small, but they're going to be frequent. 3 is not enough. Okay? Now, choice B, C, and D are good. These are right. That's why we didn't choose it, because we're looking for the wrong answer. B, I'll drink only decaffeinated coffee. Good. We don't want caffeine. Choice C, I'll begin oral intake by taking only clear liquids. That is wonderful. Why? They just had surgery. So when they start liquids, we want to start them with clear liquids only, right? So if they vomit and we see it red or pink, we know they're bleeding, right? Okay, and we're going to do it step by step, so that's good. And then choice D, I'll eliminate carbonated beverages from my diet. Absolutely, no carbonated beverages, no Coke, no Pepsi, no soda. Period. We don't want carbonated beverages. So that is why A is the correct answer. A client who has undergone a fundoplication wrap for hernia repair is preparing for discharge. Which discharge instructions should be included in a teaching plan for this client? A, you should avoid taking stool softeners. B, you may eat 3 normal-sized meals per day. C, notify your doctor if you develop symptoms of a cold. D, you can return to your former level of activity as soon as you are discharged. The only correct answer here is C, call your doctor if you have symptoms of a cold. What happens when a patient has a cold? They're doing what? Coughing, right? We don't want this patient coughing. They just had a hernia repair, and that pressure of them coughing can open up that surgical wound. We don't want that to happen. So C is the correct answer. Now let's look at our wrong answer choices. A, you should avoid taking stool softeners. Excuse me, I just told you we don't want anything to increase the abdominal pressure so their wound doesn't open up. If that patient doesn't take stool softeners, what are they going to do? They're going to be bearing down. Do we want them bearing down? No, because them bearing down will do what? Them performing that Valsalva maneuver increases the abdominal pressure and the wound might open up. So we want them taking stool softeners. So when they have a bowel movement, it comes out very easily and they don't have to bear down and increase the pressure in their abdomen. Choice B, you may eat 3 normal-sized meals per day. Absolutely not. How many did I tell you? A good 4 to 6. They need to be eating 4 to 6 meals per day. Small meals, but still several meals such as 4 to 6, not 3. On choice D, you may return to your former level of activity as soon as you're discharged. No, they need to do it gradually because that wound needs to heal, right? They can't go to the gym and lift weights. How do you lift weights? I guess like this. They can't go to gym and lift weights or do sit-ups because we don't want to increase the pressure in their abdomen and for that wound to open up. So we're going to have them do it gradually, and we want them to stay away from things that increase pressure, such as the lifting weights or the bending over or the bearing down to have a bowel movement. We don't want them constipated. That's why we're going to give them lots of fiber, lots of fluids. We don't want them coughing. We don't want them sneezing. Anything that increases pressure, we're going to have the patient stay away from. A client with a history of achalasia presents to the clinic with progressive dysphagia. For what complication related to this condition should you assess this client? A, aneurysm, B, weight loss, C, pneumothorax, or D, esophageal varices? Okay, so the correct answer, guys, is B, weight loss. Now think about it. So the patient's got achalasia, which is cardiospasms, right? And they have progressive dysphagia. What does progressive dysphagia mean? That means as time goes on, the difficulty swallowing gets even worse. Well, guess what? If that's happening to a patient, you think they're going to want to eat? No. So what's going to happen? They're going to lose weight. And so that's our correct answer right there, weight loss. All right, guys, we are down to our last question. Which client is at highest risk for the development of esophageal cancer? A 45-year-old Asian American who consumes pickled foods. B, 23-year-old white woman who's taking oral contraceptives. C, a 60-year-old Scandinavian American woman with breast cancer. Or D, a 72-year-old Native American man with diabetes mellitus. And the correct answer, guys, is A, your 45-year-old Asian American man who consumes pickled foods. And they kind of gave you two hints in this answer choice. Number one, they told you he was Asian. Asians and African Americans are at highest risk for getting esophageal cancer. And the second hint they gave you was the pickled foods. Okay, pickled foods are high in nitrosamines, and they're also very acidic, both of which can change the lining of the patient's stomach and the change the lining of the patient's esophagus, and they can end up having esophageal cancer. So A is the correct answer choice. Guys, I hope you found this video helpful. As always, I'm asking you to please support me with this channel because I'm really trying to get to my first 1,000 subscribers. So if you haven't done so already, please like this video and subscribe below. Make sure you press that notification button. And one more thing I'm going to ask you to do, please share my videos. Any friends, any co-workers, anyone that you know that my videos would help them, whether they're a current student or they graduated, they're ready to take their boards, please share my videos with them. Share it on your social media. I'm really not into technology, so I don't know what else is out there. But whatever else is out there, I need you to share it for me, please. Thank you for spending this time with me, guys. I promise I'm going to keep the content coming for you, and I'll see you next time.